Thank you, Doctor, for joining us in this case study video series, an educational initiative by Himalaya Baby Care. As India's #1 doctor-prescribed baby care brand, we strive to uphold the highest standards in every step of our journey. This case study, Transcatheter Intervention for Infantile Hepatic Hemangioendothelioma, focuses on a significant subject in pediatric cardiology. We are honored to have Dr. Vijayalakshmi, Professor Emeritus and former head of pediatric cardiology at Sri Jayadeva Institute of Cardiovascular Sciences and Research, Bangalore, with us. Dr. Vijayalakshmi will share her expertise and valuable insights from a unique case, highlighting innovative approaches in pediatric cardiology.
Namaskar. Every child is very precious, not only for the parents, for the whole world. And when it is born with some defect, all the more the pediatricians, pediatric cardiologists and others, they have to put in extra effort to save the child from the jaws of the death. I'll give you an example. A baby which was born with the lower cesarean section went into septicemia, into shock, had tubular necrosis, and the pediatricians struggled to save the baby. And despite their best effort, after 15 days, the patient was deteriorating. And at that time, the patient was referred to me. When I did the emergency echocardiography, to my utter shock, I saw that all the 4 valves in the heart had vegetation and the left ventricle had a non-compaction. So the child had a reason for the heart failure: 1, non-compaction, 2, vegetations, bacterial endocarditis, and much more than that, there were multiple vascular channels in the abdomen, probably in the liver. So I was baffled. And then we sent the patient for the CT angio, and the reconstructed image showed that it was an infantile hepatic endothelioma. And whatever treatments are there when we reviewed the literature are very hazardous, and almost 70% mortality in such patients. And that too with infection, it would have been impossible. So the surgery was impossible. The left ventricle ejection fraction was only 40% and the child was not suitable. Leave alone the liver transplant, injection of alcohol or giving steroids, all were contraindicated. So whenever the challenges come, you have to take it as a stepping stone to create a history. So you have to think out of the box, and that's what I did. Ultimately, our aim is to save the baby. So what I did was, I did the angiogram, dilated hepatic vein. I kept the ADO2 device so that whatever I inject in the feeder vessels will not go into the heart and damage the heart. So after keeping the ADO2 in the hepatic vein, I started injecting the grated foam gel. These grated foam gels are thicker, bigger ones, and they go and they don't get passed through the filter of the device. So they stay there and close the device. And once the whole vascular channel was closed and I was happy, ultimately to make the fibrosis and seal it, injected the PVC particles. And then we took the check angiogram and I saw that totally it was closed. So first we treated the patient for bacterial endocarditis for 4 weeks and then treated this also. So Herophilus says a best physician is the one who knows what is possible, what is not possible. Here it was possible to treat the bacterial endocarditis because with the high antibiotics we can control. So for 4 weeks we treated with the high antibiotics. It is possible to close the vascular channel with the PVC particles as well as the grated. We did that also. Non-compaction, it is not possible because the child is born with that. After 3 weeks, when we repeated the CT, we saw that the whole vascular channel had gone and the device was sitting in situ and the child had gained weight and it was doing well. Friends, remember, in a newborn baby, diagnosing the heart failure is very difficult. But if you put in an extra effort, you can. Invariably, the child gains 100 grams per day. If it is gaining more, you have to think. If the heart rate is more, if there is a gallop rhythm, and if the child is not able to suckle the mother's milk, it is a sick child. So in such a situation, which was a certain death, we literally saved from the jaws of death. And this is the message I would like to say, carry and give you, so that you decide. Nothing is impossible. We have to put in extra effort. So where there is will and the skill, you can save the precious babies. And this is to give an example how you can save the child when you think out of the box and go extra mile to save. And today the child is 15 years old, young boy, doing perfectly normal, and the mother is very happy. I remember how she was day and night taking care of the baby for 45 days. But now I'm very happy that we could save the child. And this case was published, and most of the people appreciated it. And this is the message I would like to give, so that every child has got a right to live, and it has to be on the top of the world. And we pediatricians or pediatric cardiologists are here to save the precious life. Thank you very much.
We hope you enjoyed this session and found it insightful and impactful. Thank you. Himalaya Baby Care proudly launches pure cow ghee range with pH 5.5, specially formulated for baby's sensitive skin from day one, that promotes skin immunity, offers an anti-inflammatory effect, protects the skin's microbiome, provides intense moisture, deep hydration and nourishment, formulated with pH 5.5. Looking forward to your valuable prescription support for Himalaya Baby Care Pure Cow Ghee range.